Hi, we're here with Dr. Haran Burri, electrophysiologist from the University Hospital in Geneva and chairman for this scientific committee for the next EHRA meeting, which will be held in March in Vienna next year. Pleasure to have you here with us. Just had a wonderful session on his bundle pacing. Everybody's excited with his bundle pacing, and we'll discuss several interesting aspects of that. Can you give us a hint, some of the challenges that we have, and actually once we have the his bundle placed, how do you program it? What's the trick, especially if you have other leads involved, backup leads? What's your hint on that issue?
Well, first of all, thank you very much for having me here in Salvador. It's really a great pleasure to be in this beautiful city. And indeed, we had a very nice session on his bundle pacing, and I was very happy to see the attendance. The room was full. So there's a big interest, I think, in his bundle pacing here in Brazil. So indeed, it's very important to implant the lead properly, get good capture of the hiss, low thresholds. But it's also very important, as with devices in general, to program things correctly, especially as today the devices that we have are basically done for leads in the atrium, in the right ventricle and the left ventricle, and not for the His bundle. There is no specific dedicated His bundle device. So that can lead to all sorts of issues, and which may compromise battery longevity and may also compromise patient safety, even worse. So it's really important to understand exactly what we're doing, especially if you're using backup leads. Now, I'm not saying that you should be using backup leads routinely in all patients. That's not at all the message. But I think that in some instances, for instance, if you have infranodal block, there's a small risk of HV block coming along. If you have also a patient that's scheduled for AV nodal ablation as a second procedure, there's a small risk that you'll be compromising the thresholds with the His leads. So, or also in some instances you may have sensing issues as well, which you can't get around. Well, these may all be situations where you may want to opt for a backup lead, especially if you're a little bit at the beginning of your learning curve. And then programming can get a little bit tricky. For instance, you can place your His lead, of course, in the RV port, and then it's just like an RV lead, and that's the easiest situation. And if you place it in the LV port, then it can get a little bit tricky. But if you place it in the atrial port, in a patient who's in atrial fibrillation, say a patient who needs ventricular pacing, you place the His lead in the atrial port, and you place a backup RV lead, well, that device thinks that what's connected to the atrial port is an atrial lead, and it's not. It's more, I would say, close to the ventricular lead than the atrial lead, so there are lots of algorithms in the device which will work differently, or will not serve the purpose of His bundle pacing. For instance, if you have ventricular safety pacing, as soon as you have pacing from the atrial port and you have His capture, you will obligatorily get ventricular safety pacing by the ventricular lead, because it thinks that there's possibly crosstalk, and it's going to deliver ventricular pacing, which is totally useless in this situation and which is going to drain the battery unnecessarily. So you need to know how to program around these things.
Perfect.